So today's presentation is about some useful tools in Embase. One is called PV Wizard, and another one would be Medical Device Search. So I'll switch my screen and we'll start looking at those interesting tools. Can you see my screen?
Yes, it looks
Okay.
good.
All right. So we're in Embase main page. And to begin with, PV Wizard, what does it mean, PV? PV stands for pharmacovigilance. And if you ask me what is pharmacovigilance, I'll tell you that pharmacovigilance is a science and activities relating to the detection, assessment, understanding, and prevention of adverse effects of or any other medicine or vaccine-related problem. Some people will tell you that it's the same as drug safety. However, experts remind us that drug safety includes various activities that guarantee the safety of pharmaceutical products throughout their life cycle. While pharmacovigilance concentrates on monitoring and managing safety of drugs after patients have started using them. So to start, I'll go to this PV Wizard at the top left corner. And here we have our main search page for PV Wizard. And as you can see, this search page or search form is made up of 5 elements: drug name, alternative drug names, adverse drug reactions, special situations, and human limit. I can type drug name right here on this line, or I might decide to use section on the left-hand side over here, and this page will allow me to find the best term. As you can see below here, there is an M tree, and M tree is a Embase subject headings tree. In other words, it's similar to Medline's mesh. So you can search it by concepts and so on. So let's see what happens if I type here Tylenol. So I just started typing, it pulls Tylenol. As you can see, there are different Tylenols here. There is a Tylenol with codeine and so on and so forth. There are all kinds of them. So Embase suggests to me that I should use term for Tylenol. The preferred term is paracetamol. So when I click on it, the word paracetamol goes right here already, preparing for search. And at the same time, you see different branches of the M tree that shows you where paracetamol fits in. Now, this plus sign on the left-hand side, you use it if you want to add something. In our case, we don't need it because it's already here. But let's say if you want to use this, you can click on plus, and then it will pop up here. Now, a little information circle, letter I in circle, it's information. If you click on it, it will show you history, synonyms. Look how many synonyms. Look how many names this variants of this drug has. It will show you Dorland and CAS registry, which is Chemical Abstracts Service Registries, unique identifier. So this is so that you know if you want to check something here. So now the term is highlighted in orange, the term that we're using. You can always select or deselect anything here if you want, or you can clear this field right here and type something else. So you have those options. So our query strategy is shown on the right-hand side. Look at this little box. So it shows right away, and the default would be here, your drug subheading or drug induced, and it will be in the abstract, title, and description. Now, if I want to see full strategy, I can click here, and here's your full strategy, and shows you what exactly you're doing. And as we continue, you can always refer to this and check it out. So what's next for paracetamol in our case? We click to the next step at the bottom right here. And before we go there, I want to show you subheadings. It will search this drug with these subheadings: adverse drug reaction, drug toxicity, drug interaction. You can add any of these or you can change them. And to do that, you just click or unclick here. So we go for these 5. These are default subheadings. So we go to next step. And in the next step, it offers us to add alternative names, alternative drug names to our query. And look, there are 355 variants, and they're all listed on the left-hand side here. And if for some reason you want to remove one of them, you just uncheck this box here. And if you want to add, you just add it here. And if you uncheck, of course, you have 354 instead of 355. That's a very useful part. You can even add more alternative drug names here if you want. If you know any alternative name, you can add it here. So they suggest for us Algodol. So you can add this, or you can clear it and reset. And when you click on reset form, and you will see it in other pages too further, it will take you to the default, to this list for 355. Now look on the right-hand side. It will search for all these variants. The default search is for trade name, title, or abstract. You can always change that. If you want just to stick to trade name, you'll just switch it to trade name. Or maybe you want to have all fields, then you can do all fields. Default is always trade name, title, and abstract. And as I mentioned to you, you have your search details here. And if we click on full search strategy, you will see how it changes. Look, this is already what we're doing. Look how far we got. Isn't it amazing? Yeah, very versatile search engine. All right, so next step for us is to check adverse drug reactions. So we will click on next step. And we proceed. And what we have here is the query for adverse drug reactions is already pre-coded. And by the way, this search string that you see here, all this pre-coded query, was created by Embase in consultations with the pharmaceutical industry. So they're all kind of legitimate terms here. Now you may edit this query, by the way, and you can do it directly inside this, inside here. See, I clicked here, and now if I want to remove something or add, I might say, I don't want to have injury here. And then I click update, and now I have the same, but without injury. If I want to go back to default setting, I'll just click reset form, and now my injury pops up again here. Needless to say that you can check your full search strategy at this point too. And you will be surprised how much you have already here. So the next step is special situations. So we'll go to the next step. And here in special situations, as you can see, you have already pre-coded option, right? You have special situations such as pregnancy complication, it could be allergy, could be falsified drugs, could be drug resistance. Look at all of this. And the same, you can change your form. You can add something else if you think there's something missing here, or you can remove things that you think shouldn't be here. And in this case, I'll stay with this. Now, next is your human limit. And when we go to human limit, we click on the next step. And by the way, before we go there, look at the search details. It shows us that we have our drug with subheadings or variants and adverse drug reactions or special situations. So we build a very nice search strategy here. So let's go to next step and continue. Now this is your human limit. And human limit here is, as you can see, it's not a big search string, not a large selection here. You have human, you have man or woman, you have child, boy or girl. That's basically it. Again, you can add something else here if you want, but I don't know, maybe teenager. So in that case, you will just click here and add. So this is the point where you can limit. By the way, as we were going, as we were doing all our manipulations, the results at the bottom, this blue button with results, was changing, right? And I should have brought your attention to that. So now it's time probably to add limit publication years. We have 182,000 records here. That's a lot. So how about we reduce it and just look something more recent. So now this is 24 to 24. This is this current year, and it shows 1,500 records. How about we also change the dates for records added to Embase? So we'll say we want February 1st to, how about March 1st? And we'll say apply. So we want to see only things that were published in the past month. And look at that, we have a result of 777. Now we can look at our results. And before we do that, let's check the full search history. Search strategy, look at that. Look what we did. Think about it, in olden days we had to do it by hand, and now computers are doing this for us. So I'll click on show results. And it's processing. And here's our results. Here are the results. Look at this. I can, of course, collapse this. But notice that in Embase, as you remember, if you point your cursor on your search history, it turns blue color. It allows you to manipulate it. So you can edit it, basically. You can change dates, or you can change words here, whatever you want. So here are all our results. Can you do something else here? Can you limit it further? Yes, you can. You can actually, on the left-hand side, you have all kind of filters here. You might want to decide and say, I want to limit it by age. And you will see that there are 27 articles that deal with newborns. You have 113 that deal with child, and so on and so forth. So suppose we're interested in just child 1 to 12 years old, and we'll apply. And from 777, we'll have 113. These are our new results. Okay. All right. So now we'll look at something else. We'll go back to Embase, and we'll look at something else. We want to see how the medical device search works. And it's useful tool. And we had, actually, I recently had students who were using it. So to do that, we'll just click on medical device. And here the screen looks a little bit different than previous one, but logistics behind the search is kind of similar, and you will see it. So at this point, it gives you add device name. So I'm clicking here. Suppose I'm not sure about device name, or I want to double check it in subject heading 3. So I say, I'm looking for medical device. And in medical device, I want to look for cardiovascular equipment. I click here. And in cardiovascular equipment, within cardiovascular equipment, I have cardiac equipment, cardiovascular diagnostic equipment. You see how it branches out? So here I can look for arrhythmia detector or cardiac occluder, and within this one I can have more details. Look how it's organized. So, but I know what I'm looking for. I can look for, I'm looking for specific equipment, and I will type the name there. I'm looking for total artificial heart. And it's right here. And notice what I like about Embase, it right away tells you how many items you have here. So I add device name. And now it tells me, oh, you have 7 synonyms there. Would you like to add them? I'll click here. And these are all synonyms that are all brand names of artificial heart. You have option here to add another synonym if you know some. So in my case, I'm familiar with some other brands, and I will add this one. And maybe I will add Jarvik Hearts, another brand. And I know another brand which is called Phoenix 7, I think. Let's see. So now instead of 7 synonyms that came up by default, I have 10. I can add them. So I have now what it will be searching for: total artificial heart or 10 synonyms. By the way, notice this picture of pencil here. You can still change here, and you can change here if you want. So suppose you want to add something or remove something. By the way, notice that there is a total artificial heart here. It's actually company name, brand name for artificial heart. That's what it's called. So we'll stick with this 10. Now look at the subheadings. The default subheading is adverse device effect. You can always change it here. You can change it to clinical trial or device economics or comparison, but we'll leave it the way it is. So we have two boxes here at this point. The first box has total artificial heart or synonyms with subheading adverse device effect. It will be combined with this box, and it will be combined with connector AND. And here we have to look for adverse effects. So when we click here, we have pre-coded search string. Look at it. Isn't it amazing? And you can edit it. Again, like in previous situation that I showed you with PV Wizard, you could add or change something here. You can reset it. Then you click add query snippet. They call it snippet. So we have it here already. It tells us also that there are 89 device-specific adverse effect terms that are specifically related to this particular device. And look, there are 89 of them. And at this point, if you want to remove some of them, you can do that. Maybe you're not interested in bleeding, or maybe you don't want to see anything about infection and so on. So you can just unclick, and instead of 89, you'll have 88 there. Okay. See how nice? You can add more if you know something. So I'll stick to this 89 device-specific adverse effect terms. And now we have another box. So we have total artificial heart or synonyms with subheading adverse device effect and general device adverse effect syntax or 89 device-specific adverse effect terms. And now we're adding with and limit options. So we can change publication years. Suppose we're interested in everything from, we're doing some historical review, and we want to see what was from 1994. And one of the reasons why I'm doing this, because I added a couple of names, or at least one of the names in my synonyms that was used long time ago. I'm not sure if it's used now, but I want to find information about it. You can also change records added to Embase and whatnot, or you can just leave it the way it is now. Also at the bottom here, you have option to see display full query. So we can click here and see what have we done so far. So this is what we did. This is what we did. Look at this. Imagine how much time it would have taken librarian to build this search strategy without help of algorithms. And by the way, you can copy it. And if you click on copy, then you can paste it in some document and keep it. Or you might want to change it somehow in the future. So let's click on the results and see the results. So these are our results here. And again, as in the previous case, we could limit our results. We can look here look if there are some diseases here. Here's an option for us. Maybe we decide that we only want to see adverse effect bleeding, or we only want to see cardiogenic shock. So here's your opportunity to do that. Or we only want to see items, information about heart right ventricle failure. So maybe we'll do that. We'll just mark it here, apply. Another option is you can limit it by age, gender, study types. Let's see what kind of study types here. Again, you have humans, control study, and maybe you want to see only case reports, and there are 15 case reports here. And that's useful if you're thinking about writing your own case report. And here's your limits. And you can continue limiting further. Okay. There are also publication types. And why I want to show you publication types, because Embase, unlike other databases, has a great coverage of conference abstracts. So this is your opportunity to check for conference abstracts. So that's about it, what I wanted to show you today. Are there any questions? And maybe Kyle will tell me if there are any questions, because I can't see them here.
I don't see any questions.
Any comments? Anybody uses Embase regularly? Any comments from people? Any comments? What do you think about it? Is it useful? Useful tools? By the way, while we have a couple more minutes, I want to show you something else, which I didn't plan to show you, but just to bring to your attention. Embase has now, in the beta testing, they have query translator. You actually can translate your PubMed query into Embase syntax. Is that amazing? And this is something we were talking about forever, because this is when students and residents are doing their searches for systematic reviews, they want to use PubMed and Embase, and there's always dilemma how to translate as precisely as possible one to another, as the search in PubMed, how to make it kind of similar to the search in Embase. So this is the solution coming. It's still in beta, so if you find something, you should test it. And if you find something unusual, tell them, because they'll be grateful to hear. Very interesting. I'm going to test it today. So if there are no more questions, I'll just say thank you so much.